Hello everyone, my name is Mary Rachel Christian and I'm here to present my patient who's been having difficulties with alcohol. She's a 36-year-old African American presented in the office. She presented in the office, reported that she had a 15-year history of alcohol intake. She reported drinking alcohol continuously for the past 15 years at the expense of her family responsibilities. She will even miss college and work due to alcoholism habits. According to Mrs. XX, she cannot control her desire to drink alcohol, and her heavy alcohol intake has resulted in significant marital problems. She has joined the Alcohol Anonymous group several times, 3 times at least. Mental status examination indicated that the patient was cooperative. She has a normal psychomotor activity, and there was no perceptual disturbance. Mrs. XX was diagnosed with alcohol use disorder as per DSM-5 criteria. Motivational interviewing approach was adopted for this patient. Motivation interviewing is a person-centered approach to therapy that develops a safe and exploratory environment for patients and thus facilitates identification of the patient's personal values, abilities, and reasons for behavior change. This approach was employed in order to encourage and motivate internal change for the patient. An assessment to understand the patient's drinking pattern, the locus of control, internal relationship challenges, as well as her attitude towards drinking was done. The perception of the patient alcoholism and its harmful effects on health, family, work, and social and her personal life were discussed. The patient's efforts to change were acknowledged, as well as her strengths and feedback were given. The supportive therapy assisted the client to realize the adverse effects of alcohol, and this increased her readiness to change. A change plan was discussed with the patient, and she was asked to identify any strategies to prevent her from relapsing. The significance of identifying triggers to the patient's drinking alcohol was discussed to ensure that the patients be able to identify the triggers and prevent relapsing to alcoholism. Motivational interviewing has been shown to be effective in treating alcoholism and other substance addictions because the client-centered techniques, self-efficacy, focus on motivation, as well as exploratory techniques promote decision-making for the patient. Now, establishing a therapeutic relationship and building trust with the patient was relatively difficult. The patient repeatedly asked about my experience as a therapist, and this was a signal that she preferred and would trust a more experienced therapist, especially in handling patients with substance disorders. The lack of trust and the poor therapeutic relationship may affect the clinical outcome. This is because evidence shows that a good and trustful therapeutic relationship promotes better health outcomes. The patient will be encouraged to identify that contemplate about her need to change and weigh the benefits of changing. According to Lacey and Street, this is referred to as the contemplation stage. This is because the patient already knows she requires the change. The patient will then be prepared for change and then take action by identifying a plan to change her alcoholism and implement the plan. The patient will then be encouraged to maintain the change and adopt strategies to prevent relapse. Thank you.